Hi, everyone. I am Amy Zelmer from Faces of TBI, and welcome to the 2018 Brain Health Online Summit. I am a survivor from a fall on the ice in February of 2014, and myself, along with Dr. Jeremy Schmo from Minnesota Functional Neurology, we saw a need in the brain injury community for more education and training on alternative healthcare methods and modalities for those that are still suffering from the lingering effects of brain injury. So each weekday during the month of March, you are going to hear from a presenter who will share their experience in either working with brain injury patients or their own real-life experience of living with a brain injury. And today I am here with Dr. Alina Fong, and Alina received her PhD in clinical neuropsychology with an emphasis in neuroimaging from Brigham Young University. She received the National American Psychological Association Clinical Neuropsychology Division 40 Graduate Student Research Award in 2004 for her research on cortical sources of the N400 and the N400 effect. Dr. Fong's interest in brain mapping soon turned to functional MRI, and since then her research efforts have been focused on the clinical applications of fMRI. So welcome to the summit, Dr. Fong. I'm so happy to have you here.
I'm so honored to be here. Thank you, Amy.
And today you're going to be talking about don't let your brain injury define you, how to take your life back. So I think this is such a fabulous topic, and I'm really excited to hear what you have to say.
Well, wonderful. Thank you. Thank you. So, I think first and foremost, I see so many patients that come to me broken because they have been dealing with this invisible injury for weeks, months, and years. And when they keep getting told by medical professional after medical professional, and sometimes even family members, loved ones, and even themselves that, gosh, I should be over this already. What is wrong with me? It can start feeling like it defines you.
Mm-hmm.
You start feeling really helpless, right? Amy, I'm sure you experienced
I did.
similar feelings. And it just saddens me when I hear patients just come to me so distraught and just so hopeless.
Mm-hmm.
And that's why I endeavor to give them that hope back, to empower them, to teach them that they can have control over this. And it's just a label, and they don't have to be defined by that, and that we can really make some positive changes.
Mm-hmm. Yeah, and I think, you really hit on a point how, my own experience was 2.5 years of doctor after doctor after doctor telling me, you're fine, you just have to rest. There's nothing more we can do for you. And then when you finally find that doctor who can help you, you're like, wow, why didn't I find this person 2, 3, 4, 5 years ago? And so I think that really is a huge problem in the community is people are not finding appropriate help soon enough, or just being told they're fine. And that starts to make you feel like you're a little bit crazy.
Yes. In fact, that's the C word, right? Crazy. Because I can't tell you how many patients come in and they start experiencing those symptoms of depression, anxiety, feeling like there's something wrong with your head and nobody else can see it. Or, I had a patient come into me with a medical record saying, this patient is hearing things that nobody else hears. Or, you just start getting misdiagnosed left and right when really you're just trying to wrap your head around how one concussion that is invisible could change your life that much, And that could be really, really devastating and can cause a whole bunch of other secondary effects that are just kind of easy to chalk up to, now they're a little crazy, now they're a little worried about this, now they're anxious, now they're just depressed, and then medication, and then medication, and medication on top of that. It's a problem.
Yeah, and that's happening far, far too often. And I know you're very familiar with that, that when I went to the neuropsychologist, she wanted to put me on Ritalin, antidepressants, and sleeping pills all in one visit. my very first visit with her. And it was like, no, I don't want to go that route. And she tried really hard to pressure me into it. And I was like, I'll consider it in 6 more months if I'm not feeling better. But, there is, and I hear over and over from other neuropsychologists, like doctors just don't know what to do with us. So they classify us into the depressed category so they can give us a pill and, hope that works for us.
Yeah, you're exactly right. And not saying that that's the easy way out, but it kind of is, because the truth is the amount it does take to overcome this concussion is substantial. The patients that come to me, Amy, they come to me at their wits' end, but they are willing to do whatever it takes. So we work hard. They come to this clinic, they do extensive neuroimaging. We do fMRIs, we do structural MRIs of the brain. I do another MRI of the neck. They do treatment all day, every day for a week, and then they do another functional MRI at the end. And so it is exhausting, but it takes so much work on your side, on the patient side, as well as all of our myriad of staff to get that patient to where they need to be. So it's hard work, but it's possible. And that's what it takes in these cases to take your life back.
Mm-hmm. And so it sounds like you do a week-long intensive type of training with your patients as well.
That's exactly what it is. In fact, we endearingly call it a boot camp. Because that's really what it is. It's basically you're here from 9 to 5, and we're guided by that functional MRI. But that functional MRI allows us to identify exactly what parts of the brain are maybe overcompensating and overworking to help other areas that might not be working hard enough just get by. So we can actually see these alternate routes and these alternate patterns. And my job is to take those areas that are maybe hyperactive in some areas and hypoactive in other areas and get them to balance.
So can you explain the difference between a functional MRI or fMRI and a traditional MRI?
Absolutely. They are completely different. So the only thing similar about them is that you're in the same machine. Okay, so if you can do a regular MRI, you can do a functional MRI. But instead of just lying in a machine and getting static images, just basically photographs in your brain, we're actually having you do different cognitive tasks. Because Amy, I can't tell you how many of my patients complain of attentional issues, right? So attention problems, executive functioning issues, difficulty with planning, making decisions, weighing out pros and cons, multitasking, memory, right? Just not being able to remember. I mean, and most of my patients, they don't have an issue with long-term memory. They can remember those things, but remembering a grocery list, they can't do that to save their life.
Yep.
We deal with verbal fluency, finding that right word. Oh my gosh, so many of my patients are, what is that word? I just get so stuck all the time.
Yeah.
Not being able to follow conversation and responding appropriately. So these are all areas that the functional MRI assesses. So you're in the scanner doing little tests that look at these areas, and I can actually see where blood is flowing to in the brain. Because I have an extensive normative database that allows me to see what normal looks like, we get a really good read of working well and what parts are working overtime, those issues. So very, very different types of imaging. The MRI it should be the standard with concussions, is because most concussions have MRIs. Is that right, Amy? You've seen that? Our patients have a normal CT scan.
Okay, sorry, Dr. Fong, you froze up for just a second there. Can you kind of repeat that last little bit you were talking about?
Sure. The point I was trying to make is that most concussions, a vast majority of the concussions I see, and you too, Amy, I'm guessing, is you will have normal CT scans. You're going to have normal, regular MRI scans, which can really invalidate what you're feeling.
Yes.
Right? You know there's something wrong, but these tests don't show that. Well, the functional MRI is so different because we're looking at where blood is flowing to, how dysregulated your blood flow is in your brain. That neurovascular connection is what's really looked at, and that's why the functional MRI can show issues when other imaging doesn't. So that's another big difference between the two.
Yeah, that's really, really cool. And so fMRI isn't available just everywhere. What type of doctors would have this type of technology?
And you know, that's another problem because fMRI is all created equally. If you find a place near you that does fMRI, one thing you should ask is this resting state fMRI or is it task related? The biggest difference is pretty self-explanatory. Resting state is you're in the scanner and they really don't have you do much. You're
Right.
just there and they'll be sitting here. That doesn't give me what I need.
Mm-hmm.
Task related, which is these cognitive tasks while you're in the scanner. And to take it a step further, if you do find a place that says they do task related, often they'll only do one or two. We do 6, and we have a normative database for all 6. So there are, I know that there are some areas around the country that do it. I can't name any off the top of my head.
Mm-hmm.
Because we are really the only ones that do it to this degree and then craft treatment for that.
Yeah, your boot camp.
Our boot camp, yeah. So, you know, we are kind of the lone wolf. However, we are planning on we're actually opening up a clinic in Atlanta.
Very cool.
So we have ours here in Utah, which is west of the Mississippi, and we're going to be having one in Atlanta in 2019, the east of the Mississippi. And then we're in talks with other clinics that might want to work together in providing our imaging as well.
Wonderful. So when someone comes into you and they've been struggling for, whether it's 6 months or 6 years, you're able to work with them, right? Because of neuroplasticity. And so my point is that someone shouldn't ever give up on their recovery just because they haven't found the right doctor yet.
That's absolutely correct. And if there's one thing that your listeners are going to take from this, it's that hope is an unquantifiable, invaluable piece of this puzzle. Once someone loses hope, it is very hard to progress.
Mm-hmm.
And so just knowing, though, that you can be decades out of your concussion, you could be weeks out of your concussion, you could be months, years, knowing that you can still improve that's the first step to taking your life back.
Mm-hmm. And, often we're told rest, rest, rest. And, there's a lot of mixed reviews on how long you should rest for. Mm-hmm. So what is your recommendation with activity and rest? And I'm talking about the early stages after a concussion.
Okay. So I think everyone still agrees that a certain amount of rest is still important. And in fact, I've had the privilege to speak with Dr. John Leddy out of Buffalo, New York, who actually created the Buffalo Protocol, which was really, over the last few years, the first evidence and research that we have to limit the rest. Rest is only a small part of this. So rest is important. How much of it, though, right, is the question. I am of the mindset, and with my patients, I typically tend to rest them for a few days, maybe even up to a week at the most. But with these typical concussions, a few days is pretty adequate, and then you want to start them getting active again. So if you've been put on bed rest now for weeks, months, unless you seek out a clinician that is more active, you might always be in rest mode, unfortunately. But if you can find a clinician that will get you active again, you know, you might end up not really seeing a lot of gains.
Mm-hmm.
The activity and the exercise is huge in this recovery. Now, the question I will always get was, well, but my symptoms get worse, or my, you know, how
Right.
do I do that? Because the headaches come back. And again, you have to work with somebody who understands that the headaches and the pain and all those other issues may not actually be concussion at that point. It may be deconditioning,
Mm-hmm.
maybe blood flow issues. There may be some other things now that we have to look at.
Mm-hmm. And so what about those secondary symptoms? What are some examples of those? And, you know, so I assume like anxiety and depression are sort of secondary symptoms as well. And so maybe if you can kind of dive into that and why they happen and what we can do about them.
Absolutely. So a lot of the primary symptoms, so let me just define primary and then I'll explain the secondary. So a lot of the primary symptoms have been classified into 4 main categories. We have some immediate cognitive changes, so orientation, confusion issues, slow processing, things just not clicking.
Mm-hmm.
Have some immediate physical symptoms like the headaches, the dizziness, right? Balance issues, light and noise sensitivity that can happen pretty quickly. Then we have some sleep issues, right? Pretty quickly after an injury, patients will start noticing that they're either sleeping way too much,
Mm-hmm.
and then as the injury progresses, they're not sleeping nearly enough, okay? But sleep can also be a secondary symptom, so I'll touch on that. And then the emotional side of this. Now, often we see personality changes, we see irritability, we see kind of a quickness to anger, temper issues. That can be a primary symptom, but I tend to group them into the secondary symptom category. So now let's talk about some of these secondary symptoms and why they occur. The reason I delineate the two is because once the body is finished dealing or understands that it's still dealing with pain, nausea, balance, dizziness, if you're dealing with that for weeks on end, anyone is bound to get down, right? Anybody is bound to start losing hope or starting to get angry and starting to get frustrated.
Yes.
So I see that the immediate concussion symptoms is kind of the primary. And then the secondary symptoms kind of come after you've been dealing with this for a while. And then it starts to affect your self-esteem, your self-worth, right? How you view the world now. You know, I've known a lot of patients that were totally fine psychologically. Then they get this concussion. They've been dealing with it for a period of time. Their symptoms start getting ignored. People start suggesting that it might be psychological in nature instead of actually concussion in nature. And they start getting very down and suicidal sometimes. And, you know, just start feeling that loss of control and that loss of hope. And so that's where I think that there is a difference. But the secondary symptoms usually need a little bit of time to fester. Now, they're just as significant as the primary symptoms. In fact, I think they're harder to get rid of too.
Right.
Right? I mean, Amy, I had a patient recently that was struggling for 17 years with a concussion. 17 years. Okay. We did the treatment, we did the brain scan, everything looked great. But then there's some habits and there's some almost this injured mentality that over 17 years doesn't just go away in a week. You know, and so those are some of the secondary symptoms that I look at too that may also require some additional psychotherapy or talking to a counselor to kind of help break out of those perspectives or those paradigms. Even though their concussion looks better, there's just some self-views and some habits that also need to change.
Mm-hmm.
That's why the sooner we intervene, the better. But we do the best we can.
Yeah. And, you know, unfortunately, it is so common in my group. I hear all the time that they're basically being written off as having psychological problems. Like, I hear, and this is something I think I want you to touch. I hear things from my members about, oh, it's been a year. This can't possibly still be your concussion. Oh, you can't possibly still have PCS. You're a year out, you're 2 years out. This has to be psychological. And, I know you have your own thoughts on, what is PCS, post-concussion syndrome. And, it's so unfortunate that, because when you're starting to be told these things, you're like, oh my God, maybe I am crazy. Maybe there is something wrong with my brain, or, in the mental realm. And, it's so confusing because we already don't understand what's going on. And then to have doctors not understand, and then just it just turns into this vicious cycle.
It does. You're right. You're right. But to answer your question, yes, you can improve, even though it's been years, even though you've been told that it's not a concussion anymore. What I start thinking about is, did you have these symptoms before the concussion?
Right.
Did you have suicidal thoughts before your concussion? Did you have those feelings of helplessness and hopelessness and those issues with self-worth before this whole path started? And most of the time, the answer is no. Of course, every once in a while, people can feel this way during different events in their lives. But usually with my patients, we can identify that the concussion changed something.
Mm-hmm.
And years of not being understood is what contributes to them kind of losing who they are and really just starting to identify themselves as a concussion victim,
mm-hmm.
as a concussion patient. And that's what I want to do. I just want to break that chain, break those chains, break the mold, and have these patients take this back and just say, you know what? Yeah, I had a concussion, but it's just an injury. It doesn't define me, right? And I have power over it, and I can make the changes. And, most of the patients I see have normal structural brains, meaning that, we're not dealing with diffuse injury. We're not dealing with tumors. We're not dealing with intracranial issues. They have a normal brain. That means to me that this brain can change, because I know that plasticity is real.
Mm-hmm. Absolutely. And so, what recommendations do you have for someone to have a successful recovery? I assume, finding the proper doctors is high on that list.
Yes, absolutely. So number one, if there's anything they take from this, it's that there's still hope. Okay. There's still something that they can do. So that's the first thing. Secondly, if they are still resting and they're in that mode, talk to their doctor about being more active, because most of the time the doctor is just too nervous or worried about pushing you too far, because they're worried that might, it's going to trigger all the symptoms. But what we understand about concussions is that the more physical activity you have, the better you're going to be, and the faster we can get over this concussion. Find a doctor that is comfortable doing that, and understands how important that physiology and that exercise side of it is. Okay. Thirdly, if you are on medications or you've been prescribed medications and you don't think that they're working, or they're not really targeting the issue, you don't see a change, talk to your doctor about getting off of them. Now, of course, if you are suicidal, if there's issues with self-harm or anything like that, then you may need to stay on those. But I'm saying, if you're on these meds and you really don't think that they're helping you, talk to your doctor about that. Because a lot of times there are medication interactions and there are side effects of these medications that are exacerbating the problem, or mimicking symptoms that we as clinicians are trying to get rid of. Fourthly, it's okay if you're not in Utah to contact us. Most of our patients now, about half of our patients every week, come from out of state and often out of country. And so find that specialist. There aren't very many of us doing what we do right now. But as soon as I hear of more places, I'm going to let Amy know. In fact, Amy, I just presented at a conference in Austin, Texas called ASN, or American Society of Neuroimaging. Wonderful conference where I actually got to connect with another concussion center run by neurologists up in Buffalo, New York. Now, they don't have functional MRI yet. We're talking about partnering up with them to do that. But regardless, they have a team of about 29 neurologists, and most of them, or many of them, do concussion work. Okay, and so there are other facilities in different areas that can help, but just make sure that you are researching them. We don't like to deal with medications, and we do advanced imaging. Other places are big on medications, but for short periods of time or whatnot. So do your research. It's okay to call and ask that clinic question. Be assertive and take control of your injury, and just know that you can change. Take your life.
Absolutely. Yeah, thank you so much. And I know that you also have an offer for our listeners, if you'd like to share that.
Sure. Yes, we are offering $500 starting today till the end of March, $500 off any scan or any ensuing epic treatment that they might qualify for. So please, give us a call. I always start with a complimentary consultation. It's important for me to get your medical history, to really see if you would be a good fit or a good candidate for what we do. Because, unfortunately, we can't accept everybody. We do have some limitations, which we can talk about in a bit. One of them, really quickly, is we currently cannot take children under the age of 7. Okay? Just because of the demands of the imaging and the demands of the treatment. So that is definitely one of the limitations. But if they fill out paperwork, I will call them, or one of my colleagues here will give them a call, and we'll see if they're a good fit.
Yeah. And I know several people in my tribe have been to Cognitive FX and have had wonderful results. So I'm so thankful for doctors like you, Dr. Fong, that are really out there trying to really help people with brain injury, because it's so misunderstood, and there's just not enough information out there, I don't think, that's getting to the proper channels to help people. So I'm so thankful for people like you, and Anna, who works with you, has just been wonderful too. So thank you guys so much for doing what you do.
Thank you. And Amy, can I give a little plug real quick?
Sure.
Yeah, so I am a member of the U.S. BIA Public Policy Committee, as well as the Brain Injury Alliance of Utah. And I just want to say thank you to you, Amy, for your commitment with all this, and for, being willing to be a part of our community outreach in October. We're having a conference here. Thank you for everything you're doing and increasing awareness.
Yes, thank you. I'm really looking forward. I believe it's October 12th in Provo, Utah.
Yes, and Amy's getting a functional MRI when she comes down.
I sure am. I can't wait.
Yeah, we can't wait too. We can't wait to just to work more together. So thank you, Amy.
Thank you. And thank you for being a part of the summit. I appreciate you taking the time today.
My pleasure.
And thank you, everyone, for watching. I really hope that you have gotten some great information from Dr. Fong. And just remember, every weekday during the month of March, check your email for our daily presentation. If you're not able to catch them all live, you can purchase all the recordings for $29, with the proceeds going to the Brain Injury Association of America. So thank you, everyone, and I'll see you in the next episode.